Hello, everyone. In this podcast, we will be discussing sensitive topics such as sexual assault. It's important to take care of yourself while listening. Some suggestions are listening while you're in a healthy headspace or knowing who you can reach out to if you become upset. Our 24/7 helpline for crisis calls based out of Central Florida is 407-500-HEAL. By contacting the national hotline at 1-800-656-4673, you can get support and learn about your local resources. There's always someone ready to help. Welcome to the Victim Service Center podcast. Here we sit down with professionals that serve survivors and victims of trauma or those who've experienced violence and have conversations about social issues. This week, we are talking about men and mental health. My name is Emily Mitchell. My pronouns are she, her, and I'm the education coordinator at the Victim Service Center of Central Florida. With me today, I have Jasmin. Jerry uses he, him pronouns and is a multicultural and athletics counselor at Rollins College in Winter Park, Florida. Jerry earned his Master of Arts in Marriage, Couple, and Family Therapy at the University of Central Florida in 2019 and is a registered mental health counselor intern. He has a passion for working with athletes and their families to address concerns including depression, anxiety, life transitions, retirement, identity exploration, and many other psycho-emotional concerns that are unique to the athlete population. So Jerry, thank you so much for being here today.
Thank you for having me. I'm very excited to be here to talk about concerns that are unique to men, and just honored to be here.
Thanks so much, Jerry. And I also have returning probably for the millionth time, Kevin Fox. So Kevin uses he, him pronouns and is a victim advocate in an adjunct position with the Victim Service Center and Zebra Coalition, serving survivors in the LGBTQ community. Kevin worked as a high school teacher while receiving his Master of Arts in Clinical Mental Health Counseling from Rollins College. His passion when working with clients is to help them increase their resilience and satisfaction with their everyday lives. He seeks to help clients increase their meaning from life and live more authentically and honestly. So hi, Kevin. Thank you so much for being here as well.
Yes, I'm always happy to be a part of a podcast.
I'm really excited to talk about this today. And as just a brief introduction, according to the National Institute of Mental Health, approximately 1 in 5 Americans live with a mental illness. And of course, among those Americans are men. I'm going to be reading through a lot of different statistics, and I always like to mention that when I do, these are just reported numbers. So this could be happening a lot more frequently than we realize, but this is just what we know. But Mental Health America reports that over 6 million men experience depression every year. Over 3 million are diagnosed with a panic disorder or phobia. And among eating disorders, men make up 10% of those diagnosed with anorexia nervosa and 35% of those diagnosed with a binge eating disorder. So despite this, men are actually less likely to seek help, and things like male depression actually often go undiagnosed. And furthermore, the CDC actually reports that 1 in 6 men are victims of sexual violence within their lifetime, yet there are many, many barriers to seeking out help. So today we are going to break the silence on this topic. And we're going to be talking about barriers men face when accessing mental health care, if certain disorders look different in men, the anger iceberg, so what exactly that is, male suicidality, which is helpful for this month, which is Suicide Prevention Month, and ways we can help support men experiencing mental illness. So with that, I'd like to just first start off with you, Jerry, if that's okay. I'd like to ask about your role at Rollins College and the population that you primarily serve.
Thank you. So My role at Rollins College is I work in the CAPS department, so the Counseling and Psychological Services department for all students. My title is Multicultural and Athletics Counselor. So the primary demographic that I serve is the BIPOC students, so that's Black and Indigenous people of color, and student athletes. And I guess what got me interested in working with this population is I obviously, as a Black male, I understand some of the concerns that Black male students may have in a predominantly white institution. Also, working with athletes, I always viewed athletes as an underserved population. Whether that's student athletes or professional athletes, I've always seen them as a population that doesn't necessarily get the care that they should be getting, that they deserve. And there are many barriers to that. I think that the stigma associated with toughness and what that needs to look like has always been around, and it's basically served as a barrier for athletes to seek the care that is available to them.
Absolutely. And that actually was a question I was thinking about, Jerry, because I feel like, and we're going to talk a little bit more about kind of the stigmas about men and mental health and how men have to kind of overcome that toughness as well. But I assume that that's even compounded with these intersectional identities of being part of the athletic population, which I didn't even think of. I think that that's really awesome that you have that passion to work with them specifically, because it's not a population that we talk about when we think about things like vulnerability, which is kind of what I wanted to ask you next. I wanted to talk a little bit about this concept specifically. So how would you define vulnerability, and why is it important for this topic?
I see vulnerability as being comfortable and feeling safe enough to share what is beneath the surface, not what we see on the shell, but what is actually happening for us on the inside. So it's important for men to understand what vulnerability is and how it can benefit them, because I think growth comes in a state of vulnerability. If you're not vulnerable, you're not really living your true life, and you're not really addressing the concerns that are beneath the surface. So over time, if men continue to suppress and push down emotions, then they'll come out in the wrong way.
I really like the way that you reframed it to being a benefit for them. I think when we think about the concept of vulnerability, we might think of like weakness, which of course is kind of this, if we're thinking about like gender boxes, which we'll talk a little bit more about, that isn't a word that's typically associated with the male box, right? And so that's rejected, and therefore vulnerability is then rejected. And then I love what you said, where we have to be vulnerable to be open to things like growth, and of course things like seeking out mental health services, and also therapy itself is this journey of growth for whatever that looks like to someone. So vulnerability has to be there. So kind of working into that, and of course, Kevin, you can jump in at any time as well. With vulnerability, how does this kind of work with toxic masculinity here? Is toxic masculinity kind of a barrier for men when it comes to being vulnerable?
Absolutely. I mean, toxic masculinity, the idea of toxic masculinity is that it's a toxic view of what masculinity should look like, right? So society has these ideas of what men should, how men should act, what men should look like, what men should say, and vulnerability really isn't part of what that definition is. So, toxic masculinity here is it is a barrier because men are told from a very young age that they shouldn't cry. Men are told from a very young age that they shouldn't act a certain way. Men are told that they shouldn't dress a certain way. Otherwise, that their manhood is basically stripped away from them.
Yeah. And, Yeah, they definitely are competing ideas really for what you just said. If toxic masculinity says that being vulnerable is a weakness, then innately that's going to be taught to be denied in a lot of men. So the hard part is, how do you undo one while supporting the other in a way that seems safe and inviting, in a way to properly unlearn those like negatively held beliefs.
That's such a good point. And going, I wanted to uplift too, like that idea of where men are taught very young to not, that it's not okay to cry. I know that research shows that when there's like a baby girl or a baby boy crying, the baby girl will be immediately comforted compared to the baby boy. So we're like immediately already kind of treating people differently based on the sex that they were assigned at birth, and essentially saying there isn't space for you to have different emotions like sadness. And just like we were talking about earlier, how like depression is very undiagnosed within men, it makes sense why they're not allowed to show some of the major symptoms of depression.
Yeah, I just wanted to comment on the stat that you presented about babies from an early age, our predisposition to pick up a girl or meet her emotional needs before we do that for a boy. And, unsubstantiated here, but I wonder when you look at attachment theories and talking about secure versus insecure attachments, I wonder if that has anything to do with how men present in relationships in their adulthood.
It makes a lot of sense. Yeah, I've been like running into the concept of attachment theories a lot on these podcasts. I definitely need to do a whole episode on them because attachment styles are like coming up again and again. So again, like I mentioned earlier, according to the National Institute of Mental Illness, the prevalence of mental illness, again, this is just reported numbers, is less so in men. They are also less likely to seek services. So let's talk a little bit about some of those barriers that men are facing when it comes to seeking out those services. We talked about, not wanting to be vulnerable, but are there other things that are also being a barrier? Like, are things accessible to men? Is this being talked about enough? Things like that.
I think access is definitely easy nowadays. I don't know. I mean, sure, some rural parts. I'm thinking Orlando, right? Like, how many counseling private practices do I pass just on my way to work? There's probably a few dozen. So they exist. As far as what is the marketing, and obviously the whole point of this podcast is to break apart some of those gender ideas. In a similar sense, a lot of men who are maybe in a more rigid form of masculinity don't vibe with maybe the way of advertising that counseling is, which is like, take care of yourself, take a hot bath, drink a glass of wine, watch a funny show, things that just don't register as quote unquote masculine self-care. So I think some of the softness, I guess, is not masculine enough to get someone whose core problem is around lack of vulnerability. It's not pulling them in the door. So I think the way that it is being advertised is maybe not clicking with a lot of men, which I know it's ironic because we're breaking apart the gender boxes, and yet innately there is just some. I always laugh, like you go to the men's soap aisle and everything is like black, and it's like smell of like the Amazon and the iceberg. I'm like, what is that? Like, that's not a smell. It's not a smell. So we see it all the time in advertising, like the same product for men is in a black box versus and with really hard lettering, and for women it's like soft and curly and it's pink or white. So we see it all the time. So how do we make an advertisement, or how do we make counseling appealing to men who still look at masculinity in a very specific way?
Yeah, I agree. And Speaking to the question, I think that mental illnesses are underdiagnosed amongst men and probably underreported as well. Going back to vulnerability, if men aren't vulnerable enough to share what they're truly experiencing, then their mental diagnoses won't be properly diagnosed. So, being underreported is definitely contributing or is a barrier to men getting the diagnoses that are appropriate for them. Additionally, I think that access includes representation, and there aren't many men in the field of mental health counseling, or as many men as there are women. So lack of representation, I think, certainly plays a role as a barrier to help seeking.
Absolutely. And I would also say, again, there's that intersectional piece too, like how many of the male therapists, how many identify within the BIPOC community, how many identify within the LGBTQ plus community. So I think that, yeah, representation, we say it a lot, but it does really matter, especially if you're going to be meeting with someone and being vulnerable with them and wanting them to understand where you're coming from. Makes sense that you would want to relate to a therapist or a counselor that would understand that. Not that they couldn't, but it would make sense that you'd want to see someone who kind of is coming from a community that you're coming from, if that's important to you. Absolutely. I think that those are all like huge barriers. And while you were talking, Kevin, I believe that the VSC also kind of did a little bit of rebranding because they wanted to appeal more to not just like the feminine, the typical feminine or idea of our societal idea of feminine. Because for a long time, we're really close, like with the butterfly and the idea of like transformation and healing and things like that. And we've kind of made our logo a little less butterfly-ish. It's still kind of there. But yeah, there was that concept of, we know that, men do experience sexual violence, but we just weren't seeing them coming through the doors as much as the stats say they should. With that, I also wanted to talk a little bit about this concept of quote unquote manning up. So what is this concept and why is it detrimental here? Have you seen it with your clients?
Yeah, it boils down to that early top belief that like you can handle this on your own. You don't need anyone to coddle or take care of you. You have to be your own savior. So like pick yourself up, stop crying and move on. So it doesn't allow for the teaching of the idea of processing an emotion, right? So when something bad happens, it's like, get over it, man up. And so now I have all these things that are left unchecked because no one told me it was okay to sit and think about it, or that it was okay to cry about it. It was instead, you need to move on because your feelings aren't worth the distress that an event has caused you. And doubles down on that idea of you're a man, you have to take care of yourself. There's a quote someone told me, I think it was actually from a comedian. It was part of a comedian stand-up. And she says that women are taught to look for somebody and men are taught to be somebody. So it's always been okay in traditional beliefs for women to seek out what they need in somebody else, whether it's a healthcare provider, support system, and men have to be that for themselves and for others. But they're not allowed to seek someone out who can help them or take care of them in a time of need. So it encompasses a lot, and I don't know where it came from. Sometimes I think the parent is just tired and they're like, come on, just get over it. We got to move on. We got to keep walking. We got to keep going here. But the message that it sends is exactly that, that what happened to you isn't worth processing. You have to get over it.
Yeah. And I'm starting to like picture when you're like in an athletic, I don't know, maybe like you're playing soccer or something and you scrape your knee and then there's like rub dirt on it and it's fine. So I'm kind of curious, Jerry, do you see this a lot with the clients that you work with? This pressure to man up?
Absolutely. I mean, I see it in men's and women's sports, but it's exponentially or it's exacerbated when dealing with men's sports, because the concept of manning up, I think it's a maladaptive way of coping, and it is not helpful in the long run. You think about putting dirt on a wound, and in some cases it works. It's helpful in the moment, and in other cases you can totally infect your wound. Right. So manning up, and like in athletics, there's a concept of playing through the pain, which is totally not okay. And you ask any trainer, whether it's in youth sports, collegiate athletics, or professional sports, that playing through the pain is going to be detrimental in the long run. So that concept of just shut up and move on to the next play is what has been ingrained in young athletes, and I guess going along with the analogy, men, and it can eventually lead to bigger injury in the future. So athletically, you can talk about broken bones and ruptured tendons. In the general sense, you talk about just ruptured relationships, broken hearts, and other things that men deal with.
Yeah, that is such a good point. I like that you called it a maladaptive form of coping, because I think it is kind of like, just put your head down, get through it. And then while you were both talking, the word that I was thinking of is kind of like this failure, right? Like this fear of failure, as far as like, if I have to take myself out of the game, I failed. If I have to seek services or help, I have failed, which is definitely not the case. It's definitely an act of strength to be vulnerable, right? Is that like a concept that you run into a lot, Jerry? Like this fear of failure?
Yeah, definitely a fear of failure and fear of letting others down. And I look at Simone Biles and the heat that she received during the Olympics, where she was experiencing the twisties, which was a concept that I had never heard of before. But she essentially lost her place in the air and didn't really know where she was going to land. And it's something that gymnasts experience pretty often. But she took herself out of competition because she didn't want to hurt herself, number one, and she didn't want to hurt the team. But social media and the media in general didn't understand what she was going through, so they berated her for it. And that was disappointing to see. I look at Kevin Durant, who's one of the best basketball players ever. He had the same injury that I had when, although I'm not of Kevin Durant caliber, but he tore his Achilles. He ruptured his Achilles tendon in the finals, maybe 3 or 4 years ago. And he knew that his calf was bad. He knew that his Achilles was sore. In fact, he sat out several weeks. But I think the pressure came down from others for him to man up and step into the role for the moment. And it ended up costing him like 2 seasons. So when you think about maladaptive coping, it sometimes is beneficial in the moment, but it can cost you in the long run.
Definitely. I know that like when we talk about trauma, it's very similar, where there's like all these different common reactions to trauma, and some of them could be maladaptive coping mechanisms, like using drugs and alcohol and things like that. And at the time, like, you're doing what you're doing for your body to feel better, your brain to feel better. But in the long run, you're right. Like you'll be sitting out a few seasons in that example, but also what can we do to have healthier coping mechanisms that will help in the long run and be healthy? Earlier we talked about how it's possible that men are just not diagnosed enough when it comes to mental illness. I'm wondering, do you think that depression or anxiety look a little different in men, or they show symptoms of depression or anxiety a little differently than other people?
Yeah, I think so. I think in the core, right? Like I can go in the DSM and say like, okay, you've felt feelings of sadness for 4 or more weeks at a time. And that's vague in itself because how do I tell you what my feelings of sadness are? Someone's crying all the time versus someone who is numb. I think they do, especially in terms of what am I doing with that emotion or that feeling or that symptom? How is it showing itself? So anger is the default emotion for men. And as we'll get to in a little bit, like it's a mask for sadness. And so some men who may be depressed, instead of showing sadness, they might show irritability, and they seem frustrated and they can't explain why. And it's masking that grief or that sadness or that loss or whatever is really going on beneath the surface. When it comes to anxiety, instead of having anxiousness or fear of something, is it self-doubt? Is it self-deprecation? Is it that inability to focus and absent-mindedness? So many mental health diagnoses and illness can look so different from person to person. And I think what you see in a lot of men is trying to mask the overt symptoms. So like depression and sadness is usually what you think of. They're trying to mask that emotion that they see as bad or weak, and then it turns into something like anger or irritability, because they don't want to admit that they're sad. Whereas we know that for women, it's easier to be allowed in society to admit when you're sad. There obviously is a double-edged sword of that, right? Like, oh, women can't be in charge, they're so emotional, they're crying all the time. Like, we know that comes with its own plethora of stereotypes. But men aren't even allowed to say it, whereas women are. But they still get punished for it. So everybody loses.
I was going to say, this is an excellent example of sexism hurts everyone. It just does, right? But Jerry, I wanted to see if you had any thoughts on that too.
Yeah, as we stated earlier, it's not okay society says that it's not okay for men to cry. So, for men to show sadness, it's just not common based on the societal norms. So men typically will disguise their sadness, or they'll suppress their emotions. And I think depression and anxiety will look different because that component isn't there. The component of emotional expression isn't there. The component of like when you think of anxiety, think of someone that's jittery or constantly on edge and thoughts that are erasing thoughts. Well, I think that in men that are suppressing those feelings, it may not appear on the outside, but it may appear in the form of avoidance. Anxiety, for example, complete avoidance, the inability to think clearly. So I think that's the primary difference for anxiety. For depression, I think the behaviors are going to be slightly different as well. It's definitely not common to see a man crying because, as we said, societal norms don't necessarily support that, but it may show up in different ways, such as just isolation, substance use, and just other maladaptive forms of coping.
Yeah, and I what I'm hearing is that it could be that, and I understand that we need the DSM and things like that, but it seems like it's written from not really a multicultural lens, and it's not really written outside of maybe like the world of white women who are affluent, which is probably where we get most of our research from when it comes to mental illness. So it makes sense that there are certain criteria that individuals may not meet, even though they are experiencing the mental disorder or the mental illness. So yeah, I think that there's a lot of work that we can do. Shifting gears just a little bit here, we talked about how there's male survivors of sexual violence, like 1 in 6. If you go to 1in6.org, they'll tell you all about the stats. It's a wonderful organization. But we're still seeing how they're also not getting the services that they deserve as well. So Kevin, what are some of the barriers male survivors of sexual assault face when it comes to healing after trauma or seeking out those services?
Yeah, I think a lot of what we have said, especially as far as vulnerability and that being difficult to share such a high level of trauma, is hard because it's hard for anyone to share any kind of trauma. But when it specifically comes to sexual violence, there's an entirely different air of masculinity being challenged. I should have been able to fight them off. I should have been. I should have been able to outrun the situation. I should have been more in control of myself. Like I was weak, so this happened to me. And then like it even depends too if you're cutting it, you know, if you're splitting hairs about it. Was it a straight male assaulted by one or more straight men in order to humiliate them? Was it a straight man assaulted by a woman? And of course, he should have been able to fight off the woman. Was a straight man assaulted by an LGBT person? And they should have been tougher than them because LGBT people are sissies. Was it a gay person assaulted by a straight person in the form of a hate crime? Like, there's so many intersections within that one instance of trauma that it affects those reactions. So you can get specific with it, but I think the core is a lot of times a fear of like, I should have been able to fight them off, or like I was too weak. And so now admitting that is part of the help seeking process to say what happened to you. And because again, we're taught not to come forward with our problems or that we should be able to handle them, it's kept inside, or it's hidden by such a layer of shame. We know that sexual assault for anyone has shame involved, but it's amplified when you're the person who is a male and you should have been able to handle and control the situation and you couldn't. So there's a lot of just variables all over the place when it comes to that male survivor component, that I think further complicates that situation.
Yeah, I totally, yeah, all the different scenarios that you listed too were like totally different. And I can see why like these are it's so complex. And like there's this idea that men aren't even survivors. There's like a myth that people think that men don't experience sexual violence to begin with. And so reaching out and sharing your story, where most people don't believe survivors anyway, but especially they will may face this fear of not being believed even more so because of the gender that they identify as.
Yeah, and to that point, historically, up until recently, and I think there might be one state that like only within the last 3 years changed the definition, but for the longest time, most states only defined rape as a penis penetrating a vagina without consent. So if you were a male saying like, she assaulted me, it was at most, I think, only like a second degree misdemeanor. Like it was qualified under like sexual harassment or something with pretty much, little to no punishment and little to no ability to prove.
Yeah, that's so powerful. I can't believe how recent that was, that change. And with that, I wanted to just kind of highlight that the VSC absolutely is there as a wonderful resource for anyone who experiences any kind of trauma. So regardless of the gender that you identify as, regardless of whatever walk of life that you're coming from, there are counselors ready to help you. The VSC is here. We have male counselors like Kevin, but and therapists as well too. So that's really important.
Speaking to the shame associated with sexual assault amongst men, I think culturally, or some cultures shame men for speaking out because they see predatory behavior as a badge of honor. In some cultures, young men lose their virginity as early as 5 years old. And in some cultures, it's okay for young men to be preyed on by women at an early age, and it is praised. So society tells men that if you are hooking up with an older woman, that it's okay. And that is totally not okay.
Yeah, absolutely, Jerry. Like, I don't know about you, but I like rewatch movies all the time, and like rewatching any 80s film, what is the usual like side story is this young boy who gets to get with like the hot older 30-year-old neighbor, and it's like, no, that's not, that is childhood sexual abuse. No. But yeah, what you're saying is absolutely true. It's hard to go back and watch those for sure. So thanks for bringing that up. That's a total another piece to it that I didn't even think about. I wanted to talk a little bit more about gender boxes. On a previous podcast, we had a whole episode on it, actually. These are essentially gender norms that we place on women and men, and we talked a little bit about them. And anyone who falls outside of these boxes are seen as lesser and are treated as such. And we talked a lot about how there's this big gender expectation that we put on men as far as not expressing emotions. So I'd like to talk a little bit now about the anger iceberg. So have you seen your male clients only able to kind of express anger? And what exactly is the anger iceberg?
The anger iceberg is a tool that I use in therapy to help men understand what's going on beneath the surface. So if you've seen an iceberg before, you'll notice a bit of ice on top of the surface of the water. I guess if I could paint a picture here, that's where the anger would be. But anger is a secondary emotion, and there's usually something else that's driving the anger, and that's what's beneath the surface. And beneath the surface of an iceberg is a huge boulder full of ice, or in this example would be stuff or other emotions that are driving the anger. So oftentimes when I'm working with men or people that have an inability to identify their emotions, we talk about reframing the idea of anger and using other words that can describe how they're truly feeling. And of course, you can't use the word angry or mad. You have to use other words that describe a scenario that lets me know how you're truly feeling. So it's really helpful at helping my clients understand that mad and being angry isn't the only emotion that you can have. There are other emotions that can describe how you truly feel.
I love that. That's super powerful. I wanted to also ask, is there additional pressure of suppressing emotions for members of the BIPOC community?
I can't speak for all cultures, but I do know that as a Black male, I was taught, again, the thought of not crying was reinforced for me. So you have to be tough. Being tough sometimes is a means for survival. So not only is it not accepted, but it's also something that you have to do just to not get picked on or bullied in your community. So yeah, I would definitely say that the need to suppress emotions is present in the BIPOC community, at least for Black males.
Definitely. Yeah, I could totally see that. And I appreciate you speaking on that a little bit. I wanted to ask you, Kevin, is there similar pressure put on men identifying within the LGBTQ plus community that you may have seen with your clients?
Yeah, yes and no. I think so. When I first entered this question, we were planning, I said no, but I think it's yes and no. I think it goes one of two ways. And a lot of that, sometimes has to do with that internalized homophobia, that can come with being a part of the LGBTQ community. But thinking more specifically of like cis male identifying people within the community, because I can't speak, especially for like a trans or non-binary experience, as far as what male pressure looks like, or like the pressure to be masculine looks like. Because I know it's there in some ways, but it's a bit different. As far as expressing emotion as like a cis gay person, I think it can go one of two ways in that I can either be like, I've already gone against society. So like, what does it matter now if I'm expressive and vulnerable and I'm going to own myself and my emotions and the feminine side of myself, and like everyone else can screw it? Or in that internalized component, there's still a lot of toxicity within the gay community that like the more masculine you are, the better prized you are, the more attention that you get, and the more just more support. I mean, and we see it still when we have huge athletes come out, when we have someone who looks like super rugged and tough, like some of the NFL players who haven't recently, or Gus Kenworth in the Olympics, they get huge media sensation. And when Adam Rippon and Johnny Weir, who are famously figure skaters, it's like, okay, yeah, well, they were figure skating, so it was a different kind of pull from society. Because one of the, and I'm not, I think they've kind of redacted how they're going to do it now because of some backlash from gay men, but like one of the former bachelors who was like, he was the bachelor, and then he came out, and then Gus Kenworthy was going to be his like gay guide, they called it. And everyone was like, okay, so we have two straight passing, super muscular, sports loving, not what a lot of gay people identify with. And they're like, okay, so this is a show for straight people to feel better about gay people, not a show about gay people for gay people. So it was, you definitely see that the more masculine you are, a lot of people who are still fighting some of that internal battle, they get more prized. Not saying that you can't be masculine and gay, but are you masculine and gay and you're tearing down femininity in your fellow community?
That is so interesting. It's kind of like this is the root of it, isn't it? When we talk about things like sexism and the patriarchy and all of that, is that at the end of the day, the root of it is this idea that the masculine is better than the feminine and the feminine is lesser than the masculine. And that hurts everyone, because now what we're seeing is there's these ideas that this is feminine, this is masculine. So therefore, I can't authentically be myself. And therefore, I have to hide this part of me that I am ashamed of. And therefore, I can't seek the services that I need. And therefore, detrimental crises happen to me. Just like, which I'm going to move forward now as far as suicidality, because men are much more likely to die by suicide than women by an alarming rate. So from the CDC data in 2017, suicide rates for men were a staggering 22.4%. For women, it was 6.1%. So essentially, women may be more likely to attempt suicide, they found, but men are much more likely to actually die from it. And I think this is a really important topic always, but specifically for September, which is Suicide Prevention Month. So why do you think that this is, and why aren't we talking about this more?
Yeah, I can start. I know it's a hard thing to talk about. The number one reason that research will support is that men will choose a more violent means. So a woman statistically might do something like pills, like an overdose, whereas men will go right for a firearm, which of course the survival rate for that is of course much lower. The statistics aren't like so clear on this, but some articles have suggested that there's more impulsivity in men's decision to do it. Like it's less thought out and planned, like a research semi-suggests, again, it's like is it correlation or causation? Like they're not sure, but it suggests there might be some more planning for a female, and then people notice that and she'll express that to friends and try to seek help beforehand. Whereas with men, it might be something happens and it's immediate and it's impulsive. The best example I have of that in modern day is when the 2007-8 recession hit. Everyone was affected, but a lot of middle-aged white men who have the highest completed suicide rate, lost everything money-wise, all their financial security, and that was the catalyst for a lot of very all of a sudden suicides for a lot of men, which tends to be the number one reason. Older males fall into that high risk category when something suddenly changes like that, like lack of financial security and they can't provide for their family anymore. It can also be if they outlive their significant other. Women are better about having social support later in life than men are. Again, because men aren't taught to share and become emotionally close to other people, except maybe a spouse is the exception. Whereas women, you have the Mahjong clubs and the Red Hat Society and the shuffleboard clubs, and they're all dominated by older ladies, but men don't have as much community as they age and have, are maybe widowed. So support system is huge.
Yeah, and it's kind of going to this capitalist culture that also ties your worth with money. While you were talking with about the recession too, and it made me think of kind of in the beginning too, where you don't, as a man, you're kind of taught to not seek help, but to actually do it and be it. And that makes a lot of sense too. If the pressure is all on them to be the breadwinner, then that is gone. Your identity is also stripped away as well. So it makes sense that there was a higher rate during then as well. Jerry, I didn't know if you wanted to jump in on this as well.
Yeah, I mean, you talk about years of suppression of emotions and years of not building healthy coping skills, is just bound to come out in a way that is probably not healthy. Someone is pushing their emotions down and they develop an inability to cope in a healthy manner. They don't have the skills to cope in a healthy manner from a young age. Then, later in life, as an adolescent or a young adult or even a middle-aged adult, then they won't have the skill set to be able to deal with adversity and deal with the trials and tribulations that come up in life. So, I think it all goes back to the societal norms that are placed on men. I think it also involves the lack of mental health care that men receive, the barriers that are present to them seeking mental health care. And it just unfortunately culminates into this big ball of unmet emotional expression and lack of healthy coping skills.
Yeah, I think that is I couldn't agree more. Thank you so much for shedding light on that. I wanted to also ask if when men do seek mental health services, when we were planning this podcast, I was kind of asking when do you see people kind of walking through your doors? Everyone's kind of coming and saying I want to work on this, I want to work on that. And something you said, Jerry, really stuck with me, which is they tend to be on the brink of crisis. So I'd like to see if you wanted to touch a little bit about that.
In my experience, in my short-lived career, I've seen men come in, not when it's too late. I don't think it's ever too late to receive help, but when they are in crisis, when they've broken up from a relationship, when they've lost a significant amount of money, when they've lost things that are important to them. So it's definitely, I guess, more of a reactive approach as opposed to a proactive approach. Even in the college setting, I tend to see females coming in to seek counseling for maintenance more than I do males. They tell me that they've been down before and they want to get ahead of some of the concerns that they've experienced in the past. Whereas, my male clients are typically coming in after things have already gotten to be bad for them.
That's such a good way to put it. I feel like the reactive versus proactive. And then, yeah, this concept of like maintenance. Again, it's just kind of showing, like highlighting what we've been talking about, where, men are less likely to seek out mental health services unless it's almost like, now I need to.
One of the ways I reframe seeking mental health care is in a masculine lens, is to talk about working out your heart the same way you in your brain, the same way you do other muscles, right? So going into the gym for the first time in a long time, you're not going to see results overnight. You might get a little pump, but it takes a while to get that muscle to be built the way you want it to be, and it takes time. So you have to work out your muscles. You have to work out your heart and your brain and all the other things on the inside, the way you do your other muscles. And I think that's helpful at painting a picture and reframing the thought of mental health care for men.
I absolutely love that. It's really putting in the work. And I love that reframing. It's a totally new way to look at it. And I think it's awesome. So I wanted to, we talk a lot about how like society isn't talking about this enough and there's all these pressures, but I wanted to see if you have, despite kind of like this bleak intro of this, if you've seen an increase in men seeking out mental health services. Are things actually being normalized, or is there still a lot of work to be done?
Personally, I have seen an increase in men seeking mental health services. But we are also, the world is in crisis right now. And I think men are needing to find an outlet. But I'm happy to see them coming through my door. I truly am. I mean, I know it's difficult, and some men haven't developed healthy coping skills in the past. But the fact that they are seeking help, they are looking for male therapists, they're looking for Black male therapists, lets me know that some of the destigmatization work is resonating with folks. Sometimes I look at my client list and I'm like, man, I have like 4 Black males coming in to see me on a Saturday. And to add to that, sometimes I have Haitian males, because I'm of Haitian descent. So, talking about mental health is certainly not accepted in my culture, but to see the number of males, the number of Black males, the number of Black Haitian males coming to seek mental health services is really touching.
That is certainly like the light at the end of the tunnel. And I really appreciate you sharing that. And that's a really good point too, there's a lot of talk happening about mental health right now. And I think it does have a lot to do with what we're going through right now. So it could be that, men are looking for services because we all are in that crisis mode in this moment. Or it could be people are talking about it more, or it could be both. But I love that you said that, whatever the reason, it's just really nice to see that they are seeking out and fulfilling those needs that they have. Kevin, have you seen anything as far as like a trend?
When it comes specifically, I think to VSC, I think things are pretty steady as far as primarily seeing females, because we know that sexual assault, that's the demographic that it affects the most. So I think knowing that there are male survivors and getting them in is still a task to accomplish. On the outside, I think in general, outside of trauma work, am I seeing a more steady increase in males and even couples seeking counseling willingly together? Yes, I would say so. I think it's becoming, especially for people who are early, young adults and up through their mid 30s, they're seeing a value in it that wasn't so, in the generations 10, 20, 30 years ago.
Yeah, that's really awesome to hear. And at the same time, I do recognize that there is a lot of work that does need to be done. So with that is just kind of a final big question here. How can we as a society encourage men to seek out the help that they need and deserve? How can we be good supporters for the men in our lives? How can we break down these myths? Basically, what would you like to say to like a viewer who really wants to enact some change? Or listener, I should say.
I think, and I guess everyone would respond differently, but as far as like feeling that comfort with seeking help, if we've built a society that says men can deem what is normal, then as a male, can't you just deem for yourself that going to counseling and seeking help is normal? Don't you have that power? If it's about making yourself the priority. And if the people around you can't support your decision, then they're not worth having. So if you're worried that the people in your life are going to make fun of you for it, then maybe it's time to seek better friends. I know that's not an easy boundary to implement, but at the end of the day, you're the expert of whether or not you're happy and if you need support, and if the friends and family around you can't get with that, then of course, have that heart-to-heart conversation. Let them see what's going on and take that time to practice that vulnerability. But then at the end of the day, if you're not with people who care about you taking care of yourself, then that doesn't sound like someone that should get to have that opinion. So, building those boundaries to create those relationships that support you and support your vulnerability and your happiness and well-being.
Yeah, and be that support for that person too. On the other end, let your, people who identify as male, let them express however they're expressing. And if you're feeling like a certain way, if a man, for example, cries in front of you and you find yourself shocked by that, lean into that and ask yourself, is that society telling me that it's not okay? Because it is absolutely okay that they're crying right now. It's okay for me to help them in this moment. It's okay that they're expressing this emotion. But I don't know if you had anything that you wanted to share, Jerry.
Yeah, I think one of the best antidotes to to decrease depression and anxiety is to challenge irrational thoughts and challenge irrational thinking. So, if you look at the ideals that have been placed on us by society, if you look at the norms that have been set, I think to challenge them and to think for yourself, it could truly be helpful and life-changing. Ask why. If you feel like a man is supposed to do X, Y, and Z, ask why and rationalize it for yourself. Put those thoughts on trial. And I think that if you're able to think for yourself and, have some individualization, then you'll realize that society doesn't always have your best interests at heart, and that you can think for yourself, and it is okay to just challenge the norm. In addition to that, you said something earlier about men feeling like they need to be the provider. Well, I think that it's important to share with men that you cannot pour from an empty cup. So if you continue to pour into others and you have nothing left, then it's just not going to be beneficial for anyone around. So I think that it's important for men to understand that you have to pour into yourself too before you can support others, before you can pour into others.
I love that. And I love that the concept of putting those ideas on trial. I love that idea. And of course, I always say to people out there, you cannot pour from an empty cup. Couldn't agree more. As a final question to you all, I do think that that's a great place to sign off. But as a final question, I wanted to ask if there's anything you'd like to say to the men out there. And if there is anywhere, if someone's like listening and they want to learn more about men and mental health, if you have any kind of like pointers of like, read this book or look at this podcast or something like that.
I don't have any podcasts or books for men to read just yet. But But I will say that the resources are out there, and it may take a little digging, but psychology today is a great tool that allows you to seek practitioners that meet your preferences. So men, for example, if you're looking for a male therapist, I believe you can select a therapist that's either male or female on their profile. I think there are also other platforms like therapyforblackmen.org that allow you to seek a Black mental health practitioner in your community. The resources are out there. They're sometimes hidden, and they're not as promoted as other pop sensations, but they're there. And if you look for it, you can find it.
Absolutely. I love that resource specifically for Black men. That's amazing.
Yeah. And I guess just to add to that, taking that time to practice that vulnerability, doing that like work within yourself, doing that body scan, seeing how am I doing? How am I really doing? And that honest conversation with yourself that if you know that help is needed, that you can take that step and have that trust within yourself to do so, instead of falling prey to the stereotypes of society that you're not worth helping yourself. That first step is hard in itself. And then, and to that very like simple point that Jerry just said, I don't think people realize like, if you want a specific kind of counselor, it's very easy to narrow down the search online. You can find exactly the kind of person that you think will be a good counselor for you, a good fit, whatever you need, you just have to ask and it's out there.
Absolutely. And you deserve it too. And with that, I think that's a wonderful place to sign off. So thank you for listening to the Victim Service Center podcast. The VSC is a nonprofit organization that provides free, confidential counseling services for victims of any kind of trauma in Central Florida. To learn more about our services, please visit victimservicecenter.org. And to everyone listening, healing is not linear and you are not alone. And thank you so, so much, Jerry and Kevin, for joining me today.
Thank you. Thank you for having me.
Yes, always happy to help.